Hi, my name is John. I'm the founder and CEO of Quietyme, and we're introducing the CareCube. The CareCube addresses a problem that we see in healthcare that can be summed up in one sentence. Don't call the nurse if you don't need the nurse. We noticed that pressing the nurse call button created a lot more distraction and disruption than we would have expected it to. Much of the calls have to do with getting simple things like water or blankets and things like this that really don't require a nurse. But by pressing the nurse call button, setting off audible alarms that sound like an emergency, it creates a lot of commotion and a lot of stress on both patients and staff. We don't need to do this. We're asking why are skilled workers, our highest skilled workers, responding to simple requests that will either ultimately be done by someone else or could be done by someone else without even involving the nurse at all. So get rid of that idea. Introduce the CareCube. 5 departments can be called with a simple reorientation of a plastic cube. So the patient picks it up, indicates their need by setting down the cube in a position showing their need on top of the cube. It sends a message to support services so they can respond quickly. When support services does respond, they simply flip the cube back to a neutral position, which sends a signal to the server to indicate that the service has been performed. So housekeeping arrived, they flip it back, and we know that the housekeeping service has now been done. We get to find out interesting things like how many times a day do certain services get called, how long does it take to respond, and we can use these things to improve our service to our customers. Staff just carries a simple Android device or an Apple device if you have those, and it's an app that runs on there so other things could be running. It's a task list. All of the tasks that would be assigned to their role show up on their screen as unclaimed. Individuals within that role choose which task they want. For instance, I'm going to touch room 307. They need water. And that goes to my task list at the bottom. When I arrive with the water and flip the cube to the neutral position, it documents exactly how long it took and whether or not that was normal, and then erases it from my task list. All of this gets documented in the background. Now, because it's role-based, you're not going to see tasks that have nothing to do with you. Because you can claim tasks, you're not going to have 2 people running to do the same thing. And because it's auto-clearing, there's very little interaction that needs to happen with the device itself. Most importantly, the nurses need not see any of this if they don't want to. The data that we collect is effortless. It's all claimed, it's all documented as soon as things are claimed. And all of this information can be used to answer staffing questions about how many people need to be available at certain times of day, what are the response times, and how does that affect our HCAP scores. Now, of course, you're going to keep your nurse call system for the nurses because you're calling a nurse when you do that. But by taking a lot of these things off their plate, you're reducing the workload on your skilled staff and you're increasing their productivity at the same time. You're allowing your staff to work at their certification level, and you're streamlining their workflow by not having disruptions, random disruptions, happen constantly throughout their day. And support staff have documented tasks that they can do easily and knock them off in a logical order based on time or importance. The math is very friendly to hospitals. The cost of our system is made up if we just save 7 minutes a day per nurse. So with 15 to 30% estimated by time studies in nurse savings, you're looking at millions of dollars of savings annually, getting all the same work done, but by properly dispersing it to the roles that are most cost effective to have tasks done. CareCube. We look forward to talking to you. Implementation takes less than a day. You could be up and running in 1 day with our system. It's wireless and it's effortless to install, and it requires no IT hosting on your site. We have very low load on your IT department. We probably need about 20 minutes of their time, and they'll never have to think of us again. Okay, thank you. We'll talk to you soon.